Hello everyone, I am Dr. Prateek. In this video, I am going to demonstrate all inside meniscus repair. This is a case of a young gentleman who has posterior horn complex tear in his medial meniscus. So we are going to use all inside device for the medial most extent of the tear. We have already advanced the slotted cannula to guide our all inside device. We are going to use vertical mattress configuration in this portion of the tear. So I am going to take first bite through the central portion of the meniscus. I have adjusted the depth of the needle to 20 millimeter. Once the tip of the needle crosses the capsule, we feel a sensation of giving way. It is at this point that we deploy the first implant. After deploying the implant, we gently retrieve the device by to and fro movements. It is important to be very gentle at this step because the implants are very delicate. Now our second bite we are going to take from the superior capsule above the posterior horn of the medial meniscus in order to complete the vertical mattress configuration. Now we are going to take a bite through the posterior capsule above the posterior horn of the medial meniscus. As you can see, the space is quite limited even after pie crusting, so it's technically a bit challenging. But now we are able to take a good bite through the posterior capsule above the medial meniscus posterior horn, and this is the time when we deploy our second implant. After deploying the second implant, now we are going to gently retrieve our device, and then we are simply going to pull the thread which is going to tighten our sliding knot. Now after pushing the knot tight, we are going to introduce the knot cutter and we are going to cut the thread flush to the knot. This completes our repair. Thanks for watching this video.